Now, at this point, there was no obvious evidence of spread of cancer anywhere else in his body. So, because of that, he was a candidate for first getting some chemotherapy and then proceeding with our cytoreductive surgery and HIPEC. Now, the patient has done very well with chemotherapy. He feels well, and as per our tests, as of right now, there is no evidence that the cancer has spread anywhere else. It still seems to be contained within the abdominal cavity. So, over to Dr. Shankar and his expertise.
That's an important point that you mentioned about, sometimes these patients have an aggressive enough tumor that it may leave the confines of the abdomen and spread to other parts of the body, and those patients are not candidates for this procedure. That's a very important point, and hence what he was talking about is us getting CT scans at regular intervals and other imaging modalities during chemotherapy or after to make sure it hasn't gone elsewhere. But I think he's done really well, and we'll know more about how well the chemotherapy has done in his abdomen when we are actually looking at the inside of his abdomen and what sort of an effective surgery he and I are able to perform. And ideally, this is a procedure that needs, specialists that are doing this procedure, and in tandem, patients do better that way, and a team approach. And I'm hoping that today's patient gets the full procedure with the cytoreductive surgery and the HIPEC. It's going to be a lot of care for the patient after in the ICU and the step down. Another important aspect of this whole concept of taking care of these patients is family support, pastoral support, the rehab and respiratory therapy support and everything. So again, like I mentioned, it's a team approach. It's not a one-person job. You have to have a significant amount of support from his office and my office, the medical oncologist's office, even before we get to this point. But I think he's a great candidate for this procedure. He's very motivated. His family is very supportive,
Yep.
Which is what you want to see. So I think we've got a good candidate for this procedure on our hands.
I agree.